Dr. Darnall is a clinical associate professor in the pain division, Department of Anesthesiology, Perioperative Pain Medicine here at Stanford. She's a co-chair of the American Academy of Pain Medicine's Task Force on Pain Psychology to really transform how we view pain psychology in this country, to get more pain psychologists out there for all of you and for everybody else in this country. And she's also co-chairing the special interest group in this same space. She's provided a huge amount of public education around this. She has regular national columns on the National Pain Report, Women's Health, More Magazine, Pain Pathways. She's written a national book, Less Pain, Fewer Pills, that we're going to be giving away. She is focusing a lot of her work on pain catastrophizing as we'll be talking about this. I will share with you that Dr. Darnall was recently just given her first NIH R01 grant. This is like the huge grant that we all strive for as a research investigator. It's the one that really defines you as, that your work has meant something, and it's giving 5 years of funding to focus on this area of a pain catastrophizing intervention. And so, we've all done our happy dance in the lab, and she's just been an incredible rock star here. Overall, in closing, Dr. Darnall has been dedicated to empowering people to optimize the mind-body connection, to reduce pain and suffering, and she's currently working on her second book on catastrophizing that's due sometime next year. So with that, please give a warm welcome to Dr. Darnall.
Thank you, Dr. Mackey. Thank you, everyone. It's really a pleasure to be here. I'm a pain psychologist. I see people just like yourselves in the Stanford Pain Management Center, and I've been working exclusively with people with chronic pain for 15 years. So I have a doctoral degree in clinical psychology. It means I spent a lot of years studying the mind and emotions and thoughts and how it all fits together. I ended up in the field of pain, and I'd like to say that I had it all planned out, but I really didn't. It just sort of like the wheel of life turned, and then I found myself in pain, in the field of pain. And as it turns out, it was very fortuitous, because when I was younger, I had chronic pain too. And so while I have a lot of training in pain management, and I have a lot of education in it, one of my most valuable assets is coming at this from the patient perspective. And unfortunately, it was fortunately, it was a quarter of a century ago when I had chronic pain. But what I wish was that back when I had chronic pain, that there was more of an emphasis on pain psychology and what I could do to help myself so that I wouldn't have been so reliant on going to the doctor to seek the magic solution that I never found. And some of you may find that magic solution, but at the end of the day, what we really want is to be best empowered to do the most that we can for ourselves, because that's what will transform our lives. And I have a whole lot more to say about that, but I just wanted to share that little bit of information with you. In addition to working with people in the clinic, I do a lot of different research projects, and Dr. Mackey just mentioned one of those. And so I'm very excited to study how pain operates and how pain psychology interfaces with pain. So I could have titled this as my talk, Empowered You, Changing Pain, Brain, and Behavior, because that's really what it's about. And that's really what we're looking for, is how do we best empower ourselves to change our lives? And where's the role of pain psychology in this? So if you want to learn more about the things that I have to tell you today, you can go to Psychology Today, and I have a column there where I talk about some of these various topics that you'll see here. What is pain psychology? How does it affect your response to treatments? All of these things. So there's a lot of information out there that's quite accessible that you can find. So all of you are here today because you have back pain, or maybe you're with somebody you love or care about who has back pain. And it really, the pain is located in your back, and so that necessarily there's often a tendency to focus on where you feel the hurt is. I mean, that's natural, right? I mean, you're sort of an expert about feeling pain there. And so here's the thing to know, though, is that even though the pain is located in your back, it's located in other places too. And this sort of sets the stage, or Dr. Mackey set the stage for our understanding of this. The definition of pain is that it's an unpleasant sensory and emotional experience. So sensory meaning sensation, what you feel in your body, that's this. You know that. You know the sensory part of your pain. It's also an unpleasant emotional experience. And so, you know, Dr. Mackey really did set the stage for our understanding of this. But what the definition tells us is that when we feel pain, we tend to have an emotional response to it. And so psychology is built into the very definition of pain. And that's really exciting to me because I'm a pain psychologist, right? It's like, that's why pain psychology exists as a profession. So how many of you are aware about how emotions may play a role in your experience of pain? I mean, for some of you, like, does pain lead to irritability? How many of you get a little cranky when you're having a lot of pain? Yeah. Or it can bring up some sadness about what maybe has changed in your life that you miss, the things that maybe you let go because you felt like you had to because of the pain. Sometimes it brings up anxiety and fear, like thoughts and feelings about, is this ever going to go away, or what if it gets worse? So these are natural experiences that go hand in hand with pain for some people. And so our emotions influence our experience of pain, and pain influences our emotions. So I want you to keep that in mind, is that it's bi-directional. One influences the other and vice versa. So pain is your harm alarm, and it's really there to get your attention. It's there to motivate you to escape something that could be harmful to you, some kind of a threat. And as Dr. Mackey mentioned, it works really well in a very time-limited situation, if you stepped on a tack or if you picked up the hot cup. But you can't really get away from pain that's coming from inside you. You can't get away from that pain that's in your back. And sometimes we try, we maybe do less and less in an effort to get away from the pain. But as you've probably observed, is that even if you do less and less, that doesn't necessarily mean that the pain goes away. So it's designed to get your attention. Well, a lot of factors influence how much attention we give to pain. And some of them are fixed, and some of them are changeable. Gender is, for the most part, fixed. Not always these days. You know, we have a lot of options, but for the most part, you know, your chromosomes, etc., those are fixed factors. And so women are more likely to experience pain and at a greater level of severity than are men. And there's a lot of reasons for that. But what's important for you to know, if you're a woman, is that you're more prone to experience pain, and therefore it's perhaps even more important that you learn various skills and techniques to have better control over your pain experience. Because fundamentally, we're a little more primed to have pain, and so there's a little much more onus on us to be mindful of the choices that we make and what we do in our daily lives. And I just want to pause and say that Good Morning America is interested in interviewing a few people. If you have interest in sharing your story with Good Morning America, please either raise your hand, make yourself known, or find your way to the back of the room, and the producer there would like to speak with you. So thank you for that. Okay, so gender being one of the things that's fixed, and we can't necessarily change that. But let's talk about the things that we can change. Our emotional experience. So as it turns out, you know, remember, let's go back to the definition of pain, that pain impacts our emotions and our emotions impact pain. Well, a very powerful influence on our pain experience is the emotion of anger. And so there's really interesting research that has really demonstrated how potent anger is. And it can be a very natural thing to experience anger. even anger at pain for how it's changed our life, or the circumstance. Maybe the circumstances around how the pain started even. Maybe it was an accident or something like that. And so what I'm highlighting here, it's not that anger causes your pain. And I certainly don't want to put forward an idea that your pain is all in your head or it's only a psychological phenomenon. That is not what I'm saying. What I'm saying is once you acquire chronic pain, once you have it, once you have back pain, all of these emotions, your thoughts, you're going to be more sensitive to it because your nervous system is sensitized, because the areas of the brain that process your emotions share overlap with the areas of the brain associated with pain processing. And for that reason, because there's that shared overlap in your brain and in your nervous system, we have to be more mindful about what our emotional experience is. And there's a lot of power there. Once you understand how these emotions influence pain, you can be more mindful about working to really work with them to reduce some of the anger or whatever those other emotions are. And in working with that, it's not that it will take your pain away, but what we're hoping to do is help you be more comfortable and have a level of control over your experience. So we're studying some of this right here in the Systems Neuroscience and Pain Lab, and Chloe, who's floating around, this was her study that she headed, and she was looking at the relationship between trauma and pain catastrophizing and chronic pain, and really found that people with a history of trauma are more likely to catastrophize, and that it's the anger, the component of anger, the experience of anger that really facilitates how much that impacts chronic pain. So something to be mindful of, so that even if circumstances happened early in your life, some type of trauma, no matter the source of your anger, it does influence your pain. So it's important to treat it. This is where pain psychology can come in, because you can work with a therapist to treat, if you know you have persistent anger, or if someone in your life has told you that you do, you're not even aware of it, be mindful of that and consider getting some treatment to change this emotional experience as a way to modulate your pain. Now, we also studied an anger treatment at our lab, and what we found was that compassion meditation helped reduce pain, and it also helped reduce anger. So it's interesting, compassion meditation, a lot of times when we have pain, it can be really natural to have some anger at your own body. Sometimes we feel angry because our body won't let us participate in life the way we want to. That can be a very natural experience. So bringing awareness to your relationship with your own body now that you have pain, and how do you feel about your body, and know that there's ways to learn to be more gentle with yourself. I mentioned that, sometimes when we acquire chronic pain, maybe there was an accident, maybe something happened at work, or a car accident. Maybe you got rear-ended, and it's really someone else's fault. Somebody caused an injury, it was outside of your control, and we talk about that as sort of being the victim of an accident. That's all true, it wasn't your fault, and you didn't ask for it. But if you are harboring feelings of injustice, and, that righteous indignation. And maybe you have every right reason in the book. It's all there. Someone did this to you. But if you harbor feelings of injustice, it does not bode well for your pain. It does not bode well for your pain, and there's very clear research on that. So if you have feelings of injustice around any circumstance in your life, know that you can help your pain by addressing that. And that's what some pain psychologists do, and others. There are interventions, some of them are acceptance type of interventions, very specifically developed to help people reduce feelings of injustice, so that they are then, rather than focusing on what happened in the past, you're focusing very positively on what can I do to help myself move towards my meaningful goals going forward. Now, this was an interesting study. This wasn't a back pain study, but I like mentioning it. This was a study I did with a colleague who we looked at people in the United States and people in the Middle East and wanted to understand how religious differences might influence pain and willingness to participate in pain treatments. And what we found was that people in the Middle East perceive their pain differently, even cancer pain, and they perceive it as something of a test from God in the Muslim religion. And so because it's a test from God, it's something that they want to endure and they don't want to take medication to treat it. Whereas that's not actually the case in the United States. And the only reason why I put that forward is to just get you thinking about how, how we approach things, our background, our culture, our belief systems, how that can influence how we interpret pain and our willingness to participate in various types of pain treatments. Now, this study was done here at Stanford. This is one of Dr. Mackey's studies, and this was conducted with Dr. Jennifer Ha and colleagues. And what they found was that people who went in for surgery, they found some interesting predictors for what predicted how much pain somebody would have after surgery and how much medication they might need. And what they found was that there's a specific component of depression, something called self-loathing. So when people really didn't feel good about themselves and really were down on themselves, that very much predicted them having more pain after surgery. And also they took opioid medication much longer after the surgery. So if you're aware of any low mood or depressive symptoms, or maybe you've just really been down in the dumps and not yourself, it's important to treat depression. And it commonly co-occurs with chronic pain. But even though it can be common, I want you to know that that's what pain psychology is for, and other therapists in the community to help you reduce some of these symptoms so that you reduce your risks for having amplified and ongoing pain. This is one of my favorite cartoons. So I'll read it for those of you who can't see it in the back. The pain starts in my husband's lower back. Then it travels up his spine to his neck. Then it comes out of his mouth and into my ears. And that's why I get these headaches. Now, you're laughing because you know what we're talking about here, right? We all do. We all do. And I especially like this comic because it involves the lower back. But what she's talking about is this idea of interpersonal stress and some social pain. It counts, right? It matters. And these social factors have a lot of influence on our stress levels, our daily stress levels, which very much impacts our pain. How many of you have observed a relationship between stress and your pain? Yeah, most people have. Most people observe that. It doesn't mean that stress caused your pain. It means that once you have pain, you're more sensitive to stress. And that's natural and expected. It's also important to be mindful of it and to know what you can do. So let's talk more about the social factors of pain. Dr. Mackey just talked about his love and pain study. Love is an analgesic. That's an interpersonal factor. So consider the opposite of love. If you're having a lot of stress or, interpersonal stress conflict, it's going to be doing the opposite of this, right? So being mindful of all of these factors in your life as influencing your pain. When we think about the impact of pain, we often focus more on physical functioning. Well, I can't, I'm not working like I used to. I can't do things like I used to. Often we're tempted to focus on that. Very new research, some of this coming out of our lab, this is headed by Dr. Drew Sturgeon, is showing that these social factors, how pain impacts your social life, is one of the most important things. And it's only just recently coming into our awareness about how important these social factors are. So here's what this person says. I keep getting pins and needles in my arms. And I love this one. I love this cartoon because, look, nobody wants more pain. None of you in this room want more pain. But this is literally what happens, unwittingly. How we feel and the choices that we make when we feel pain can make the pain worse. And if we don't have a good understanding of how this all fits together, we can be working against ourselves without even knowing it. We can be working against ourselves when we think we're working for ourselves. And so really what this is about is just understanding how it all fits together so that you can best control your experience. So this is how I like to encapsulate it. Yes, you have back pain. You have a medical condition. You may have had a spinal fusion. You've got hardware in your spine, screws, plates, all of that. It's there. It's real. But you're also participating with your pain, with the choices that you make, with some of the emotions you have. You can either dial that pain up and it'll be a little bit worse, or you can dial it down and it gets a little better. We want to get you moving in the direction of it getting a little bit better. Okay, so let's talk about pain catastrophizing. What is that? It's a lot of what it just sounds like, right? It's a focus on, often it's a focus on worst case scenario. Now, I like to share that when I had chronic pain, I was really good at pain catastrophizing. So I have a good understanding of this from the first-hand level. It's when we're focused on the pain, how bad it hurts. We have trouble on focusing on anything other than the pain. And so it kind of like magnifies the pain. And then we tend to feel helpless in the experience of pain. Sound familiar to anyone? Yeah, it happens from time to time. I mean, we can catastrophize anything. We could catastrophize our finances, our marriage, our relationship, a friendship. But it turns out when we catastrophize our pain, it has serious negative consequences, because remember that circuitry in the brain between the emotions and your pain processing, they're basically overlaid on each other, so they amplify each other. So if we catastrophize and we're having negative thoughts and emotions, it's basically feeding the pain experience. Now, how do we measure catastrophizing? We basically give you a questionnaire. It's a simple 13 items that you fill out. If you're a patient at the Stanford Pain Management Center, you have probably filled out the pain catastrophizing scale. And it helps us get an understanding of how you're thinking and feeling in the context of pain. And once we know that, then we can help you learn various skills to have better control over your experience. Okay, now I already mentioned that, your emotions and pain processing, they essentially share real estate in your brain. And that's why it's so important to be able to control it. I like to just share a little bit of the data about catastrophizing because the data are so powerful. So when we catastrophize, it literally shapes our brain's functioning during pain and also at rest. So even when you're just sitting there, not catastrophizing, you're just kind of hanging out. Like you're at back pain day and you're just hanging out. You're not catastrophizing your pain at this very moment. But if you tend to catastrophize on a regular basis, it starts to shape the way your brain functions at rest. So hopefully that provides you with some motivation to want to have a little better control over it. Can you change this? Absolutely. This is treatable. It's critically important to treat it because it will help give you back a level of control. Catastrophizing primes the nervous system for pain, and it sets the stage for prolonged symptoms. It can even change your response to surgery. I'll have a little more to say about that. So this is the way I like to explain it. Imagine that this is your pain. You live with it on a regular basis. You know it well. And when you catastrophize your pain, this is what happens. It's like picking up a can of gasoline and pouring it on that fire. And this is what happens to your brain. It lights it up. It lights up the areas of your brain associated with pain processing such that you're literally growing pain in your brain. Now let's go back to that cartoon of the gentleman with the tattoos who said, I keep getting pins and needles in my arms. Well, that's kind of how catastrophizing is. And again, it's not because you want more pain. It's just because we're not born in this, we don't come to earth understanding how all this fits together. And we don't come to earth understanding the exact skill set that we need to counteract our natural response to pain. Remember when that harm alarm goes off? It's natural to have some fear and anxiety come up. It's natural to have some catastrophizing come up. It's also important that we treat it. We need to learn to put that can of gasoline down so that we can de-escalate this cycle and get ourselves back to here. Now, we still have pain. This isn't going to take your pain away. But I would submit to you that it's much better to be here than it is here, and hopefully you agree with me. Okay, so just a couple of other things. This is very specific to back pain. Here's what we know about catastrophizing. It's associated with a lot of distress, with higher levels of tenderness, muscular tension. Catastrophizing predicts a level of disability, and it actually predicts the development of chronic pain. People who catastrophize are more likely to develop chronic pain over the course of their lifetime. And this is true for back pain too. That's how powerful your mind is. Now, that's the bad news, but I like to look at the positive. And if your mind is powerful enough to move things in the negative direction, it's also powerful enough to get things moving in the positive direction. Your brain is plastic. It's changeable. And with the right skills, you can reverse this situation. Okay, so let's just briefly talk about surgery. You can have two people go in for surgery, and they both have the same medical condition. What predicts, one person has a great response to surgery and the other person doesn't. Why is that? Dr. Mackey talked about these individual differences. What are those? Well, it turns out that catastrophizing is a very, very big one, because how we're directing our thoughts and our emotions, remember that we're directing them. If we catastrophize, we're amplifying pain processing. We're keeping that going, and then that can then become entrenched. And so people who catastrophize need more opioid medication, they have more pain after surgery, they have longer hospital stays, and they're more likely to develop chronic pain. So your doctors can have the best treatment plan in the world for you. But if we're catastrophizing, we're literally undermining the foundation of these treatments. This goes back to, remember when I said you participating with your pain? So it's not about just going to the medical doctor and what can they do? Can they do this surgery? Can they give me this injection or this pill? Because if we have some of these factors going on, we will reduce the effectiveness. Catastrophizing reduces the effectiveness of surgery, of medication, and injections. Important to know. So hopefully I've convinced you that it's important to treat it. And how we treat it is typically, right in the pain clinic, we have 8 weeks of pain psychology classes. You can sign up for those. You can get them elsewhere in the community. You can work with a pain psychologist. Now, there's some really cool research showing that mindfulness meditation reduces catastrophizing tendencies. You're going to hear more about mindfulness-based stress reduction this afternoon. But I bring this up, and mindfulness is typically taught over the course of 8 or 9 weeks. There was a very cool study conducted recently. Katie Martucci is a postdoc in our lab, and so this was a study she was involved in. And here was the study. They took people and just gave them 4 20-minute educational sessions, coaching, about some mindfulness techniques. 20 minutes over 4 sessions, so they got 80 minutes total of training and how to better control their mindfulness. It's techniques of how to, basically calm your thoughts and your emotional processes. And again, Mark Neenan's going to give you a whole rundown on it. But they only got 80 minutes of training. And what they found was that just in those 80 minutes of training, people who then went through pain testing found that their pain ratings, their unpleasantness ratings, when they were given a pain stimulus, was reduced by almost 60%. 60. Just by learning how to control what was happening in their brain. And so I thought it was fascinating. It was amazing that they learned how to do this. And there was also subsequent research showing that meditation changes brain structure and increases areas of the brain, gray matter in the brain associated with learning. And that leads to pain control. I was inspired by that study because it was 20 minutes and 4 sessions. It was 80 minutes total, and we thought, well, can we treat catastrophizing more efficiently? And so we put together a 2-hour class where it's essentially compressed pain psychology. Rather than coming in for 8 sessions, you come in for 2 hours and you learn very focused information around catastrophizing and how to treat it. Some of you in this room may have been to my class, actually. So I teach it at the pain clinic, and it's free, and you can even bring a family member if you want. And so what you learn in the class is how to better control some of these natural responses that come up when that harm alarm goes off, when pain goes off, and when catastrophizing naturally happens. What are you going to do to calm yourself? That's what you learn in the class. And this is a cornerstone of pain psychology and something we call cognitive behavioral therapy, which is a specific type of pain, specific type of psychology that's found to be most effective for the treatment of pain. You learn skills to shift your attention towards the positive. So remember, a big part of catastrophizing is we naturally want to attend to the alarm going off and these negative aspects of it. We're actually hardwired to do that. But we can learn ways to shift our attention, and that's what you learn in the class. So you learn to gain better control of your thoughts, your subsequent emotions, and you learn to actively shift your energy in a positive direction that counters helplessness. What we found is that most people, this is our pilot work, we found that most people found the class to be acceptable, useful, and were very likely to use the skills. And what we found in this pilot study was that people's level of catastrophizing was reduced. We measured this 1 month out, and we found it to be quite effective. For the majority of people, their catastrophizing was reduced by about 40 to 65%. And so what we have just received, Dr. Mackey and myself, is a very large grant from National Institutes of Health, from the Integrative and Complementary and Integrative Health Institute, and we're going to be studying this catastrophizing intervention over the next 5 years. What I want you to hear is that catastrophizing is treatable, and you have options for how to treat it. If you're interested in participating in this research, we would love to take you, because we are studying this in the context of back pain. Very specifically, we want to understand how this works with back pain. So often there's a focus on medication and what medication can do for us. And medication can be incredibly helpful. Medication can make all of the difference in the world for some people. But as a psychologist, I invite every one of you to also look beyond the pill bottle to what else you can do. And this is something I've really focused on in my writings, is how to use pain psychology to minimize need for medication. It's not that medications are bad, but I think all of us in this room can agree that taking less medication is desirable. I've yet to meet someone who says, wow, I'd love another prescription if I can have it, to treat my pain. Now, there are some outside situations, but on the whole, we know that most people don't want pain. People take medications because they just want to better control their pain. And what I'm hoping to convince you is that there are skills, techniques, ways of approaching pain treatment that don't involve medication. So that's opening the medicine box in your mind. Self-regulation of cognition, emotion, and arousal is paramount. It's the amount of excitability you feel in your body, how much pain riles you up. The key is to develop confidence in your own ability to control some of your experience, your distress around pain. And this is where those cognitive and behavioral techniques come in. This is what we do in pain psychology, is help you get there. So, I'd like to leave you on a little laundry list of some of Beth's tips for opening the medicine box in your mind. Learn mindfulness-based stress reduction. It's really fabulous. It's evidence-based. You're going to hear a lot more about it today, but I just want to plug it. It's great mind-body medicine. Learn to meditate if you're not already doing so, because the evidence is really impressive. Work with a pain psychologist or a health psychologist if you're not already doing so. And the reason for that is that they'll be your consultant to make sure that you're doing everything you can, that you've learned as much as you can, that you're applying as much as you can to help yourself. Determine whether you're catastrophizing and know that it's treatable. Use mind-body skills daily and cultivate a belief that you are changing your brain and your experience, because you are. I encourage you to focus less on what's happening with your pain. Just focus on using the skills and trust that they're working. Exercise regularly. Now, Dr. Cooley's going to talk about this later, and I didn't say a word about exercise in my talk, but it is great medicine to help you with your mood, and it's some of the best medicine for back pain. The research is there. If you have sleep problems, learn about sleep hygiene. One of the best predictors of your pain intensity on any given day is the quality of the sleep that you got the night before. It's critically important, and Dr. Pelayo will be speaking with you about that today. Don't miss that lecture. Nurture positive and supportive relationships. We're just scratching the surface of understanding how important these social factors are and determining your experience of pain and your quality of life. You want to use that to your advantage. If you have toxic relationships in your life, stressful relationships in your life, you want to work to minimize those, and that's where working with a psychologist can be helpful. Learn to nurture yourself. And I can't underscore this enough. You know, often there can be disappointment at our bodies, at ourselves for our limitations. It's important to learn to cultivate kindness and compassion for yourself. This is very powerful medicine. If you have anger towards yourself or others, take a compassion course to foster release and forgiveness to help your pain very specifically. Every day, I invite you to focus on what you can do. Source gratitude. And lastly, continue to seek out positive events such as these that help you foster empowerment. And you may say to me, well, Beth, that sounds great. I'd love to go out and foster these, go to these groups and, have these great relationships, but my back hurts too much. And so I can't, I'm waiting for that to get better and then I'll go do it. Well, it's really the chicken or the egg, because this is the stuff that's going to help you feel better. So I invite you not to wait until you feel like doing some of these things. Know that they're good for you and do them even when you don't feel like it. And then you will start to feel better. And lastly, I just want to end on this note and say that this is how I see each and every one of you and your ability to take control of your lives. Thank you very much.